the honourable member for Calgary-Lougheed.
Thank you very much, Madam Speaker. I would like to begin by telling all family members and friends present and all those far beyond these walls who've lost loved ones to fentanyl and all other opioids and beyond that my heart breaks with yours. And my comments, I suppose, Madam Speaker, come from my time as in Cabinet and Wellness and as the chair of the Alberta Alcohol Drug Abuse Commission and as the advocate for Indigenous relations, and to be honest with you, just a fellow Albertan. I would like to focus in my time, because I think my colleagues have said it well, many different angles being represented here. I'll focus in for the moment on our friends who are from Indigenous communities, all of those individuals. I know from speaking with them personally that fentanyl is a killer that's taken cruel aim at Indigenous individuals and communities, both on and off reserve. It's a terrible thing. Opioids have no respect for culture or age or anything else. And I think it's fair to say today, we all agree, this issue goes far beyond any politics. Alberta's fentanyl crisis first showed up on reserves in early 2015, and the death toll was simply staggering. Reserve leaders started blowing the whistle on the crisis as far back as 2015. The Blood Tribe was particularly hard hit, with 20 deaths in 6 months, and in one terrible day, 4 people died from an overdose. Now, for the sake of a comparison, in a small city in Alberta, maybe 12,000 people, that's equal to 20 citizens dying a terrible death in just a few months and 60 others overdosing. That's just horrifying. And it's also horrifying that it took 20 deaths and a plan created by doctors and the community before certain government action. The situation had become so dire that the Blood Tribe band took it into its own hands and declared a state of emergency. They did that a long time ago, and AHS assisted by making the antidote available to its band and training 50 members to administer it. And the band also launched an addiction crisis line. Now, 2 doctors that I've spoken about in this House more than once, the intrepid Esther Tailfeathers and Susan Christensen, who ran a clinic in the Cardston area, mobilized the community and the government to save lives. And save lives they did, by convincing the government to supply naloxone and provide reserve members with training to administer it. And that's a good thing. Now, in November of 2015, in question period, in this very chamber, I urged the government to use the tragic Blood Tribe experience as a model for other reserves facing desperate circumstances. And what did I hear? This. Yes, this is a true tragedy, said the Justice Minister. We're working with partners. We've had meetings. We're committed at looking into ways to make naloxone more available. Now, when nothing happened to share the successful Blood Tribe framework, which did save lives, I asked the government, again, to help Albertans on other reserves. And what did I hear? Well, for one, that fentanyl is one of the most extreme drugs we've seen in our time. The Minister of Health said that. And what were we told? That there's a 4-pronged approach, and not one of those prongs involved recreating the successful Blood Tribe fentanyl crisis model in other reserves. And if that isn't frustrating enough, we could ask this question: did the government take the loss of life seriously? Well, Madam Speaker, I believe that the government does take this seriously. I would never suggest that anyone in government did not want to try to gain control over a public health crisis. Perhaps in all fairness, they just didn't know how to go about it. Here's yet another successful Blood Tribe initiative the government did not jump on to assist other reserves. The Blood Tribe Police Service launched an extremely effective on-reserve crime unit dedicated to gaining control of fentanyl distribution. So I naturally asked the Justice Minister, again, in this legislature in question period, what she was doing to adapt the Blood Tribe's model to other reserves trying to get a handle on fentanyl abuse and distribution in their areas. And Madam Speaker, the response was sad at best. Here it is, right from Hansard. Well, of course, we have a number of police forces throughout Alberta policing on First Nations. There are a couple of other First Nations that have their own policing forces, but a majority of it is done with the RCMP. So we're working with those partners to ensure that they have access to naloxone and that they have access to all the information necessary going forward to make sure that they can cut off the supply. But that's it, and that's not enough. Perhaps the government of this day doesn't understand our motivations in opposition. When it comes to a crisis that is killing Albertans in alarming numbers, I would trust that nobody's looking for glory and that we're just offering solutions. So please, don't dismiss them out of hand. That helps no one. We're trying to help. So when I ask a question, and other members do, on certain occasions, it's actually okay to say, that might be a good idea, let's talk about it, let's do something about it, let's look into it. But to get political doublespeak, and then find out a year and a half later that perhaps maybe your government is kind of encouraging partners to work together, that's not just disappointing, some would call it unconscionable. The government also ignored advice from the Alberta Mental Health Review to specifically deal with opiate dependency among Indigenous peoples on and off reserve. After all, the overall rate of emergency visits related to opioids and narcotics is 5 times higher than the rate of non-First Nations, and the opioid dispensation rate is twice what it is for First Nations. And clearly, these communities do need special attention. I hope the minister in charge will look into this. Now, establishing the Alberta Mental Health Review was a positive step. I can give you credit for it. Our new Premier did that as one of her first acts. My hat's off for that. It identifies as an immediate priority creating an opioid addictions plan for Indigenous peoples. Now, the report, way back in November 2015, offered as part of its first recommendation this suggestion: engage federal counterparts to increase access to harm reduction tools on reserve. But, Madam Speaker, the province's opioid crisis progress report, released in October 2016, just 4 months ago, indicates that Indigenous relations only recently facilitated an initial meeting of representatives from AHS Human Services, Health Canada, and doctors providing services in Indigenous communities. That's a full year and a half after the crisis began. And there's more. According to the same provincial report, on November the 7th, 2016, Alberta Health had started working with the Alberta First Nations Information Governance Centre and the Indigenous and Northern Affairs Canada, our federal partners who have so much responsibility for Indigenous peoples. And the Associate Minister tells us this has been a priority. Well, I think it's fair to say actions do speak louder than words. Now, Madam Speaker, I'm outlining this history because it displays that while perhaps well-intentioned, this government, pardon me, I've lost my space here. This government needs to look further. It's out of its depth on this, and it does not appear to be taking the epidemic seriously enough. As evidence, I note the NDP will not use the word crisis. Yet everyone else has, from the federal health minister to the mayor of our largest city to BC's premier, who declared a public health emergency in the past, let's set the record straight, when her people began dying from fentanyl in alarming numbers. Now, Mr. Speaker, it's time for Alberta to do the same. So on behalf of all Albertans, and especially as PC advocate for our Indigenous peoples, I implore this government to declare a public health emergency, and please, please, pay special attention to First Nations, Indigenous, Métis, and Inuit Albertans in the process of establishing a coordinating body to oversee a desperately needed, fulsome response to opioid crisis. Now, in the 30 seconds that I have left, I was hoping to quote an article from the Rocky Mountain Outlook from just 4 days ago entitled "Wesley Band hosts meeting to discuss community solutions for drug problems. I won't